I'm an orthopedic surgeon trained in both New York and Boston. I did my medical school in New York City. I did my spine specialty training in Boston, Massachusetts. I came to Delaware 29 years ago as an orthopedic spine surgeon with specialty training only taking care of adult spines with traumatic and degenerative injuries. Since that point, I've been a member of First Aid Orthopedics. I started the spine practice here. We now have a dozen different medical practitioners. Over the course of those 3 decades, I've been co-chair of the Department of Spine Surgery at Christiana Hospital, and for the last 15 years, I've been the head of workers' compensation for the state of Delaware in writing new laws, writing new guidelines, and all of the related parts that help take care of injured workers. I stopped doing clinical spine surgery 2 years ago. In the last 2 years, I've been focused on developing our regenerative medicine program. And that program has been really essentially focused on providing the best quality care in the regenerative medicine space, doing it the best way we possibly can. And that's what we're talking about today in terms of our successes in doing that. I was always interested in fixing things. So for me, I was always happy in the garage with tools. And I knew that I wanted to go into medicine and be a doctor really since I was a little kid. And when I was in medical school, what I did is I had an opportunity to work with one of my professors who was an orthopedic surgeon. So I went to his operating room and I watched him do hip replacements and use tools and screws and drills. And I thought about it and I thought that was a perfect job for me. And ultimately, I went into orthopedic surgery as a specialty. And then in orthopedic surgery, I realized that most people didn't want to do spine, didn't want to take care of patients with back pain. They thought it was too complicated. They didn't really like it. And most people seemed to be more focused on taking care of sports medicine and injured athletes. And I really focused my entire career on managing spine problems and being expert in that area. So for me, I found it more intellectually gratifying to be an expert in a small space. And that's what I've done. And I'm sort of applying that same logic now to move from spine surgery into regenerative medicine. When I decided to open the regenerative medicine clinic at First State Spine, and what we soon realized was that the services and the quality of care provided in the state of Delaware was poor. So what I decided to do was to open our regenerative medicine practice within the confines of First State Spine, where we have 3 spine surgeons, we have 5 interventional physiatrists, and another 5 or 6 physician's assistants, all working on a spine team. And when we did it, we realized how complicated the science was and the expertise needed to be very good at what we wanted to be good at. What I did is I thought it would be more useful to have just 2 or 3 of our teams specially trained in doing nothing but regenerative medicine, and that's really what I decided to do. So I play what would be really a consultative role, or I'm a consultant for my partners, so and the other doctors in the community and the people that necessarily call just because they've heard of us. So they will all those new patients will come through me and my assistant Bonnie O'Connor. We will see all of those patients to start. We'll sort of do a de novo or a new evaluation of those patients when they come to see us. So regardless of the 2 surgeries they've had or the physical therapy they had or the imaging studies that we had, we basically start from scratch, understand what the problem is, and then my job is to sort of find the best place for them in terms of their medical care. Sometimes it's going to be surgery, sometimes it's going to be nothing, sometimes regenerative medicine fits the bill for what they have. And if it is regenerative medicine, then we start an educational process where they'll come back in, they'll meet with Bonnie, they'll go over our protocols, and if we go past that, we do their procedures. I'll allocate the cases to the doctor who specializes best in those particular diagnoses and treatments. And then we follow up all our patients afterwards. And we follow, if you're going to go into our regenerative medicine protocol, you've got to agree to be followed for a year afterwards. So we're collecting scientific data to know that what we're doing is correct. And that's worked really well. So we've made it easy for my partners and provided a higher level of expertise on evaluation when patients come in to be seen. There are multiple factors that are important in understanding what a patient might need. So I frequently see patients who come in for a specific treatment based on the x-ray readings that they've gotten from another doctor. And I have to sort of make an effort to try and explain we don't treat x-rays, we treat patients' symptoms individually. So the first part of an evaluation includes understanding what the patient's problem is. Not when they come in and say, oh, the doctor tells me I have a herniated disc. It's like, no. What is the actual problem? Does your back hurt? Does your leg hurt? Are you limited in your walking, your bending? Can you work? Can you support your family? I mean, the clinical important issues that are the result of having a bad back. That's what I have to know first. Then we do a physical examination because we can't skip putting our hands on people, and it's not uncommon when we see patients and we examine them thoroughly. They'll say, boy, no one ever did that before, and which is discouraging, but it's important for us to do it right. And then we review all of their diagnostic studies and information. And at the end of that, we put it all together as an integrated program or package of what I think is the best care. Now, most often, when patients come in and go through that process, I don't have enough information. So even if they're sent in by another spine surgeon, I will necessarily order other tests, order other diagnostic studies, and at the conclusion of all of that, usually we can get everything done within a month, I'll know what the plan should be for those patients going forward. First State Spine is unique in that it's sort of like a two-part answer. First State Spine is the business of providing spine care services to the community, and we function as an ambulatory surgical center. So from the perspective of First State Spine and Spine Care Delaware, which are the sort of two integrated parts of our practice, we have in our practice the most fellowship-trained doctors. We have the most spine specialists. And we provide services really at a level and an organizational level that most practices can't really match. You know, our services spread the entire state. We have available services and offices in Newcastle County, Kent County, and Sussex County. And overall, nobody really can compare in terms of resources that we necessarily have. In terms of spine care, as I think that's sort of an integral part of First State Spine, Spine Care is a standalone ambulatory surgical center that does nothing but manage spine injections and interventional pain and regenerative medicine. So it's not a clinic where you're going to go and get a knee arthroscopy on one day and a carpal tunnel on another day and then a spine procedure on a third day. We do nothing but specialize in spine, and we do it at the highest level. We've been awarded the highest levels of certification by Medicare and AAAHC, which is a ambulatory surgical center certifying body, and we've had literally almost the only clinic that's had multiple perfect scores for that up and down the East Coast. So we're very proud of our team and the service that we provide. We don't believe it could be done any better than where it is than the way it's done here. Well, what I think what's interesting about what we're doing now, 2 years after we started doing regenerative medicine, if we understand how Spine Care Delaware started, it started as an effort to control all of the different aspects of spine surgery under one roof. Because when I originally started this 30 years ago, I had to rely on somebody else to get an MRI. I had to send somebody elsewhere to get physical therapy. I had to get somebody else to do an injection that was not part of our practice, and it became unwieldy. And in my mind, if I wanted to be the best at what we did and offer the best service, we had to control all of those parts. We do pretty much everything. And I like to think we do it as best as you possibly can. But when I was thinking of retiring from spine surgery 2 years ago and decided to look into regenerative medicine, what was fascinating was we realized that regenerative medicine was all of a sudden coming up to prime time where the results and the scientific data was good enough to offer it to patients. And when we started, we anticipated it would be a useful tool. So when I look at what we offer in our business and our practice, we have a lot of tools, and I suspected that regenerative medicine would be a useful tool. What's been remarkable is that it's become this paradigm shift in how we process and think of patients, because now we're able to get patients better, at least as good as we were with surgery, without doing surgery. So patients can come in, and an hour or an hour and a half later, they can leave with Band-Aids. They don't have scars on their belly and their back, and they don't need 3 months of rehab, and they're not out of work for 6 months. They have dramatically reduced usage of opioids. They have a much faster return to work. And the results of the outcome and the results of what we've been doing have been staggeringly good. We just did an internal analysis of all of our patients that have had at least 6 months worth of follow-up. And we found 80% of our patients are at least 50% better, which is a big deal. And 50% of our patients are at least 80% better without surgery. And the best part of that is all of the patients that come to see me are otherwise candidates for surgery. So these are people that were referred to us for evaluation for an operation, and we decided we could try something different, and we're making those patients better, easier, faster, and dramatically cheaper than surgeries. You know, win-win-win, we're getting patients better, and they've been exceedingly happy with the services that we provided for this. Given that we're in this building where we have physical therapy, one of our physical therapists that's been working with us for the last 15 years injured herself on the job. So she had a workers' comp-related low back injury with a herniated disc. And over maybe a dozen years or so, she had 2 or 3 sort of small surgeries. And while each surgery made her temporarily better, her overall problem in her back gradually worsened. I mean, she had progressive degenerative disease in her back that warranted, either a major 3-level spine surgery reconstruction. And given that she's a spine physical therapist, she really didn't want to do it. And that's what, those are the patients she takes care of that are tough to take care of with difficult recoveries. So when we started doing Regen Med, she came in and said, I want to do it. And we did a 3-level procedure for her, which is the most that we typically do, is a 3-level procedure, occasionally 4, but 3 is less common than 1 or 2. And we did her procedure, and she came back to see us at just 2 weeks. And at 2 weeks, she said, my life is altered by how I feel. And at 6 weeks, she came back and said, I'm not just good, I'm like off the charts good. And she said, what I didn't realize was how much my life was colored by having a chronic back problem. I only worked 2 days a week. I couldn't do things with my kids. And there was nothing that I ever did without saying first, am I going to pay for this, and can I do it without repercussion? And she says, now I'm able to do things without actually thinking about it first. Her back pain or her leg pain is totally gone. Her back pain is like 90% better. And her life is irrevocably altered for the better by having had the process. And literally, she was here for an hour and a half. She left with Band-Aids, and within 2 weeks was already dramatically better than she was when we first started. So, I mean, I would look at a patient like her as what sort of gets us up every day and what motivates us to do what we do. And, when I was doing surgery, like we used to call those the saves, where people had bad surgery or bad diagnosis or a bad outcome. And they would come to see us, and we would work hard and get them better, and that was always gratifying. But it was really hard work. This regenerative medicine is much easier to provide a significantly improved outcome on a much easier basis for both us and the patient. So we're tremendously excited by what the future holds. We're getting better at it really on a monthly basis. I'm just, again, very, very excited to see what we can do going forward as the science improves more and more every year.